Radiation poisoning happens when a radioactive substance gives off particles that get into a person's body and cause harm. Different radioactive substances have different characteristics. They can harm and help people in different ways, and some are more dangerous than others. Normally, radiation occurs in a safe environment. Whether or not it becomes dangerous depends on how it is used, how strong it is. Show often a person is exposed. What type of exposure occurs? Show long exposure lasts. A dose of radiation from a single X-ray is not normally harmful. Nevertheless, the parts of the body that are not being X-rayed will be shielded with a lead apron to prevent unnecessary exposure. The technician, meanwhile, will leave the room when taking the image. While one small dose is not dangerous, repeated small doses could be. A sudden, short, low dose of radiation is unlikely to cause a problem, but extended, intense, or repeated doses can be. When radiation damages cells, it is irreversible. The more often a person is exposed, the greater their risk of health problems. How much radiation is dangerous? Radiation dosage can be measured in various ways. Some of the units used are grays, sieverts, rems, and rads. They are used in a similar way, but 1 radian is equivalent to 0.01 gray. Below 30 rads, mild symptoms will occur in the blood. From 30 to 200 rads, the person may become ill. From 200 to 1000 rads, the person may become seriously ill. Over 1000 rads, this will be fatal. According to the Centers for Disease Control and Prevention (CDC), radiation sickness, or acute radiation syndrome (ARS), is diagnosed when a person receives over 70 rads from a source outside their body. The dose affects the whole body, or most of it, and is able to penetrate to the internal organs. The dose is received in a short time, usually within minutes. A person who experiences an atomic explosion will receive 2 doses of radiation, one during the explosion, and another from fallout, when radioactive particles float down after the explosion. Symptoms. Radiation sickness can be acute, happening soon after exposure, or chronic, where symptoms appear over time or after some time, possibly years later. The signs and symptoms of acute radiation poisoning are vomiting, diarrhea, and nausea, loss of appetite, malaise, or feeling unwell, headache, or rapid heartbeat. Symptoms depend on the dose, and whether it is a single dose or repeated. A dose of as low as 30 rads can lead to loss of white blood cells, nausea and vomiting, headaches. A dose of 300 rads dose may result in temporary hair loss, damage to nerve cells, damage to the cells that line the digestive tract. Stages of radiation sickness. Symptoms of severe radiation poisoning will normally go through 4 stages. Prodromal stage, nausea, vomiting, and diarrhea, lasting from a few minutes to several days. Latent stage, symptoms seem to disappear, and the person appears to recover. Overt stage, depending on the type of exposure, this can involve problems with the cardiovascular, gastrointestinal, hematopoietic, and central nervous system (CNS). Recovery or death, there may be a slow recovery, or the poisoning will be fatal. Hematopoietic stem cells, or bone marrow cells, are the cells that all other blood cells derive from. Different doses, different effects. The risk of illness depends on the dose. Very low doses of radiation are all around us all the time, and they do not have any effect. It also depends on the area of the body that is exposed. If the whole body is exposed to, say, 1000 rads within a short time, this could be fatal. However, far higher doses can be applied to a small area of the body with less risk. After a mild dose, the person may experience symptoms for just a few hours or days. However, a repeated or even a single, relatively low dose that produces few or no visible symptoms around the time of exposure may cause problems later on. A person who is exposed to 3000 rads will experience nausea and vomiting, and they may experience confusion and a loss of consciousness within a few hours. Tremors and convulsions will occur 5 to 6 hours after exposure. Within 3 days, there will be coma and death. People who experience repeated doses, or who appear to recover, may have long-term effects. These include a loss of white blood cells, making it harder for the body to fight infection, reduction in platelets, increasing the risk of internal or external bleeding, fertility problems, including loss of menstruation and reduced libido, changes in kidney function, which can lead to anemia, high blood pressure, and other problems within a few months. There may also be skin redness, cataracts, and heart problems. Localized exposure may lead to changes in the skin, loss of hair, and possibly skin cancer. Exposure to certain parts of the body is more dangerous than others, for example, the intestines. The effects of radiation are cumulative. Damage to cells is irreversible. If you like the video, kindly subscribe in this channel. Baby Time FYI. Thank you.